So when thinking about pharmacologic therapy for patients receiving dinutuximab and immunotherapy for neuroblastoma treatment, some of the things that we take into account at our institution are the supportive care around these immunotherapies and what agents patients could maximally benefit from. And so one thing that we've learned is using opioids as a continuous infusion as well as rescue bolus doses for the pain. And we meet with patients prior to them starting therapy to determine what opioid would be the most efficacious for them. A lot of these patients are heavily pretreated, and so a lot of them have previous exposure to either morphine or Dilaudid. And so we talk to them to see if there's one that they tolerate more than the other or have less side effects with. And so this is very patient specific. In addition to this, we start Neurontin or gabapentin in our patients to help combat the neuropathic pain component with dinutuximab. And so when starting this for families, we also like to counsel them that the patient may feel more sedated as we titrate the dose up. Because patients are receiving a lot of pain management therapy during the dinutuximab therapy, one thing that we have seen in our patients is constipation. So starting a constipation regimen or bowel regimen for these patients is important. Again, these patients are heavily pretreated, and so a lot of these patients know what agents work for them. And so that's just a conversation that we have with them to see what would be the most efficacious. In addition to that, patients typically receive Tylenol and Benadryl as pre-medications before the infusion starts to prevent allergic or anaphylactic reactions to the infusion. We preferentially use Benadryl or diphenhydramine at our institution, but there are other institutions that have used Atarax as well. So that is something that could be used. And then some patients experience anxiety during the infusion, and so having rescue lorazepam has been helpful as well.